Hello, my name is Mark Sherman. I'm a general surgeon practicing at Surgical Associates of LaJolla here in San Diego. Our office is right across the way from Scripps Memorial Hospital La Jolla, which is right outside my window here. I wanted to talk to you just for a moment about something called a sentinel lymph node biopsy. Your doctors may have mentioned to you, if you have certain kinds of cancer, about having a sentinel lymph node biopsy. Now, this started really with melanoma. Melanoma is a type of skin cancer. And one of the important things with many types of cancer is to know, has that cancer moved to a lymph node? Because that may mean that you need some additional treatments, sometimes chemotherapy, radiation therapy, other operative procedures. And so we want to be very careful in those cases and know if there's cancer in that lymph node. Well, many years ago, the way to do that was take out a bunch of the lymph nodes that were near the area of cancer. If you had a melanoma on your leg, that could mean removing a lot of lymph nodes in the groin. Well, it turns out, if there's no cancer in there, that had a lot of side effects. We're taking out a lot of lymph nodes, people could get leg swelling and complications and infections, and if there was no cancer in there, we didn't need to take out all those lymph nodes. And on the other hand, we do want to do something really thorough if there is cancer in that lymph node. We want to know, down to the finest detail really, sometimes even a few small cells of cancer in the lymph node. So how do we do that? Well, what we want to do is focus on the important lymph node, the sentinel lymph node. Sentinel is a little bit like a guard. It's standing in front. It's the first one that you encounter. And the way we do this with melanoma is by injecting a material near the area of melanoma. And it's just a little solution in a syringe, and it has a very low dose radioactive signal. And this protein with this low-dose radioactive signal flows through these lymphatic channels and gets filtered out at the first lymph node it comes to. So at the time of your operation, I can use what's essentially a sterile Geiger counter, put it right over that area where the lymph nodes are, and find the lymph node that's showing up with this material, the very first one that it came to, and take out that lymph node. Now, some people, there's a couple lymph nodes that show up with this, but we don't have to take out 14 lymph nodes. You can just take out sometimes one, sometimes two, three. And the really good thing about this is not only is it more accurate, but our pathologists, imagine if before they were kind of checking 5 different areas in a lymph node to look if there's cancer. Could they miss an area? Maybe. If there's 10 lymph nodes, that's 5 times 10 is 50 slides that they have to look at. But if we give them one lymph node, that sentinel lymph node, they could examine that lymph node in much more detail and sometimes find even just a few cancer cells in that lymph node. And so these sentinel lymph nodes can be not only very accurate, but also limit the amount of surgery that we need to do, because when we send them that node, if that node's negative, we usually don't need to take out anything more. Your recovery is easier, the discomfort is less, and the side effects are less. That technique has been advanced to the point where we do that now with breast cancer. It's a standard for breast cancer for many years, and even used in some other cancers as well. So if you do have a cancer and your doctors are talking to you about lymph node aspects, you should ask them about a sentinel lymph node and ensure that they're doing that for you. If you have any questions, please don't hesitate to contact our office, check our website, or look at our YouTube channel. Thank you very much.